I'm Dr. Don Miller, and I'm a clinical psychologist. And just a little bit of background. I had my first internship in 1958 while I was attending the UCLA Graduate School of Psychology. I rotated through 4 different Veterans Administration hospitals over a 2-year period. Then I transferred to the University of Utah and received my Ph.D. in 1966. And I was licensed in the state of California in 1968. And so today I'm going to talk a little bit about PTSD, or post-traumatic stress disorder. And there is DSM-5, which is the Diagnostic and Statistical Manual of Mental Disorders. In my book, the last self-help book that you will ever need to be happy, I have some quotes from the DSM-5, some descriptions of how some of the things that go on that would qualify you for that diagnosis. And of course, there's also information about PTSD, just about any website you want to look at. But with PTSD, there's flashbacks, nightmares, a lot of times anger, sleep problems, depression. So where does that come from? Let's say way back there, maybe Lucy, if you remember her. I guess they say she went back 3 million years. But anyway, some of our primitive ancestors were suddenly gobbled up, eaten up by something that came. And so the survivors would be now hyper alert. Anything that smelled like a tiger, let's say if the saber-toothed tiger had gobbled him up and run off with him. Anything that smelled like a tiger, anything that maybe hinted of a tiger, anything that looked like any memory. And so this was actually a protective mechanism, because then you go into the fight or flight mode and you start screaming, hollering, and you're getting out of there, and you either fight like crazy, you're pumping full of adrenaline, or you get eaten. And so that mechanism of like trauma and things that happen that are bad, we still have that mechanism going on, that kind of traumatic memory kind of thing. And so the more it happens, the more somebody is in Vietnam or in Afghanistan, the more they are exposed to trauma. Like somebody goes over there and a year in Afghanistan, come back, a certain percentage are going to have PTSD, flashbacks, so forth. 2 years, a higher percentage. 3 years, even higher percentage. So PTSD is closely related to extent of trauma, length of trauma, intensity of trauma. But there's a number of programs where these old memories can be altered. And there are ways of laying down new memories over the old ones. Different ways of revisiting the trauma. There's a number of exposure techniques, as they call it. In other words, you are calming yourself down, you're relaxed. Then you tell the story of it in groups, or you visualize it in talking to somebody. And as you visualize these events occurring or reoccurring, since you're staying calm, then you've changed the memory pattern. But if all you do is become frightened every time you think of the memories, you actually increase the chances of the PTSD getting worse. You strengthen these memories. So in other words, it's variations of exposing yourself to these memories while being relaxed or some kind of other experience at the same time. Then you can change the way the memory is laid down. Lay down new memories. Cancel out some of the old ones, or maybe all of the old ones. So now in my book on the PTSD chapter, it goes on pretty extensively. But I'm just going to cover a couple treatment options. And if you're curious, then you might want to go check out more of the book on Amazon. So, let's get started. Rewind therapy. Alex was in Germany, and they brought him casualties from Afghanistan. And as an x-ray technician, he would x-ray body parts, or the whole body, or the soldiers, or the ones with horrible wounds, with the ones that have passed or deceased. And so, as time went on, he would just have recurring nightmares and even flashbacks to these experiences. So, the rewind technique. I had Alex, imagine he's sitting in a chair in front of a TV set that has a video recorder, and he has a DVD that he's prepared. And on this DVD is a number of scenes. I said possibly 20, 30 different scenes of some of those horrible things that you had seen. Bodies that you had to x-ray. Sometimes the smells. But now you have a go button, a start button, and you're going to push that start button, and you're going to play one of these scenes that you've picked out. But before you start, we're going to do an out-of-body experience. So what I'd like you to do is imagine that out-of-body part, or maybe spirit self, if you want to call it that, or it's like so many people have reported, oh, I was in surgery and then I had this out-of-body experience. I floated up to the ceiling and watched them do the surgery. So we asked Alex, float over about 4 or 5 feet away. And now you can't see the TV, but you can see the other Alex's face. So now, watching Alex's face, then you turn on the DVD player. And so you see Alex's face as he's watching this DVD. And you notice kind of what the expressions on his face are. Let's let it run for just a couple minutes, not too long. So when that was done, when that video was finished, I said to Alex, now you're going to float back over and rejoin. So now the two of you are together. And now, while you're watching the screen, you've combined yourself, you're watching the screen, and now you rewind at fast speed. And so the video of some of the traumatic things that you saw are flashing backwards. You can't really make it out very well. Just little glimpses here and there, little hints of it here and there. So now when you've rewound it, now you run it forward again, but fast speed. And so maybe you feel like you want to do that a couple more times. Rewind quickly. And since it's only about a 5-minute video, it might take just 20, 30 seconds. Then fast forward again until you feel comfortable. Then go to the next video that you find interesting, or that you feel like you want to watch next. Or not really watch next, but watch Alex watching next. And I'm pleased to report that Alex had a real good experience with that. He stopped having the nightmares. He stopped having those flashbacks. So now, another one. How about, there's a IRT, image rehearsal therapy. This is one of my favorites. This is, let's say, a person was raped by their father, possibly multiple times. So they're having flashbacks. They're having intrusive flashbacks. They're having nightmares. So now I ask them, let's go back to that last nightmare and pick it up at the point where Daddy's coming down the hall and Daddy is kind of bouncing off the walls because Daddy was usually drunk. And he gets to your room. He reaches for you in your bed. And just then, just before he touches you, you realize, or you see this little flickering light, and you wonder what that is. Then you realize, oh, that is my flamethrower. So you grab the flamethrower and turn it on Daddy and pull the trigger, and this big ball of napalm comes out and covers him up. And he's screaming, he's jumping, finally he falls to a heap on the floor. Now that was a pretty cruel thing to do to Daddy. But typically Daddy's already been dead for years and years. And sometimes people would have to do that a few times. And sometimes just once or twice would do that. And once in a while the trauma was so great that I wasn't able to erase it at all. But there's studies that show about 85% of the people who do therapy, who expose themselves to therapy, experience therapy, make some improvement or a lot. It can vary to either, but only 15%, according to the American Psychological Association, really don't gain anything at all from therapy. So therapy is probably a good thing to do in general. So now another one I liked was time travel. So this guy works at a hospital, and he can't go to work because if he's looking at records, his job is kind of going over. If he's looking at records, he starts having panic attacks because he's afraid that in the records someplace he's going to find that this child that's in the hospital was molested. And the reason he has that terrible fear is because he was raped when he was 5. And it was a cousin who had taken him up to a loft in a barn. So now I'm saying, remember, and you have the nightmare about it. You have the nightmare, and you remember what happened. So you're walking up the stairs, up to the loft in the barn. The little you. But now, the grown-up you is following behind. And you get up to the loft. And your grown-up cousin tells you, take off your clothes. And just when he reaches for you to make you take off your clothes, the big you walks up behind your cousin, puts him in a chokehold, and he falls to the floor unconscious. Possibly dead. And then you escort the little you out of the barn back to safety. So we had another appointment the following week, and he didn't show up. So I called him, and I said, well, we were going to work on that some more. And he said, what? Oh, I forgot the appointment. And I said, well, what's going on? He said, oh, well, yeah, I'm back at work. And so you're back at work. Well, what about the fear? What about the fear about that you're going to see the notes in the chart that the children had been molested? He said, oh, I got over that. So I'm probably not telling you all my best cases. And I can't remember how many pages are in that chapter, but there's a lot. There's a lot of examples, a lot of things to do, a lot of things that I've helped the people with. Basically, relaxation, imagery, visualization. And so if you want to see the whole deal, like I said, it's in the book, The Last Self-Help Book You'll Ever Need to Be Happy. And like I said, it's a little arrogant, but on the other hand, I think that I did help some people, and I'm hoping that the book and this video helps you. Thanks for watching, and here's the information on where to get my book.